This is Fatima with Fatima Fridays, and we are back. Thank you guys so much for being here today. We're going to do a different kind of show today. It's going to be completely different, honestly. So bear with us, but I want it to be a little more professional. I want it to be more interactive. So if you have questions, concerns, whatever the case may be, I definitely want you to chime in, inbox me, or just write it on the app, and I will be able to see your questions and we'll be able to read them. So let me just go to my regular spill here. You guys already know who I am. I am Fatima with Strong Heart to Soul Incorporated. And you know that I am Fatima Fridays. And I'm so nervous. You guys don't even understand. Today is going to be a great day. I have my doctor in the building.
Nurse practitioner.
My doctor. She's my doctor. I don't know. She might be y'all nurse practitioner, but she's my doctor. And y'all know that I'm the CEO of Strong Heart to Soul Incorporated, a business where we educate, prevent, and work to eradicate heart disease in underserved communities. We're going to talk about many topics today, from heart health to nursing school and her new position as an instructor, college instructor. So I'm really excited to speak with my guest today because I've always had so many questions to ask her. And, you know, I like to get all in people's business. So, so I'm going to get all in her business today. Today we have a very special guest. Her name is, I'll give you her real name, and then I'll tell y'all what I call her. Her real name is Melissa Fincher Murgy, also known as Lisa, just Lisa. She is a nurse practitioner, but she has been my doctor for about 15 years now. Lisa has many letters behind her name, like the whole alphabet. But the ones that I know that is most important to her is MOM, mom, and wife. So I love her. She's a wonderful person. She's an educator, and she is a friend, someone that I can call by cell phone, by email, by Facebook Messenger, and she's always there for me. And I just appreciate you so much, Lisa.
Thank you so much for those kind words.
Oh, of course. And congratulations on everything. Welcome to the show.
Yes.
I am so excited that you are here. I'm really kind of nervous. Like, I don't get nervous often because I'm a talker. But I am kind of nervous.
Listen, I felt like I'm coming to Disney. I didn't sleep last night.
That's crazy.
I'm too tired. I'm too excited to sleep.
That's okay. We're going to have so much fun. It's because, you know, everybody, when they come here, they're talking about they're nervous. They don't know what to say. They don't know. But it's so chill. It's like a family, right, Frank? We like family here. So we talk about anything. We talk about everything. And I ask you guys, if you have any questions, definitely type them in, because you know, she's a doctor. I don't know what I be talking about half the time. I mean, I know, but I know, but y'all know. She really knows. She's trained. So definitely we're gonna get into some things. So first of all, I got to get all in your business. So, all right, what is the difference between a doctor and a nurse practitioner?
Oh, that's a loaded question. How much time do we have?
Oh, we got about 2 hours.
Nurse practitioners go through many years of education.
Mm-hmm.
For myself, I started through a diploma program, which was a 2.5-year program in Toronto. And then I went through a bachelor's program at Damon College, which was 3 years. And then I completed my master's program at UB, which was another 3 years, 3.5 years, before I was able to practice as a nurse practitioner. And now nurse practitioners must have a doctorate.
Oh, really?
To be able to practice. They grandfathered the rest of us in.
Mm-hmm.
But at this point now you have to have a doctorate. So, however, they don't carry the doctor term generally into practice because they don't want to be confused with physician.
Mm-hmm.
So a physician will go to college, do an undergrad bachelor degree in biology or some kind of science, some kind of STEM degree. They may even do a liberal arts degree and then take what's called the MCATs, which are a graduate school entrance examination. And they have to score a certain amount on those
really
MCATs.
hard.
They are very, very hard and they're very, very rigorous. Not something I would certainly want to be up against. Not sure how I would do on those, but I'd love to try. But I'm 59 now, so why? Yeah. So although maybe we could talk about the discussion I had when I was turning 40.
Yeah.
And that was the time when I became a nurse practitioner, because I had that discussion with an ER doc who used to be a nurse.
Really?
And she said, Lisa, you can be 40 and a nurse pushing stretchers, standing on your feet for 12 hours, or you can be a nurse practitioner and be seeing patients and writing orders and doing the practice that you can do. So
it sounds like we got a caller, Lisa.
Yeah.
Maybe not. Maybe not. They hung up.
Okay. So physicians then, after their bachelor's program and the MCATs, they go into 4 years of medical school, and then they go do, in their final fourth year, they do a clerkship, and then they decide what specialty they wanted to go into, and then they go into their residency program, which is another, depending on what specialty they're doing, So the time frame for me to have achieved what I do is generally about the same as what a physician does. Nurse practitioners pigeonhole themselves extremely early on. So in their master's program, they decide that they're going to become a family nurse practitioner or a pediatric nurse practitioner or a psychiatric nurse practitioner, an adult nurse practitioner, a geriatric nurse practitioner, right from the get-go.
From the start. Okay.
So a family nurse practitioner, you're, pardon the vernacular of it, but it's cradle to grave.
Okay.
You're from birth to death.
Right.
You are allowed to see all that entire population of patients. So, for instance, when I went through my family nurse practitioner program, I was interested in emergency medicine. I thought that was what I was going to do for the rest of my life. I'd already done it for 27 years.
Right.
I thought that's it for me. That's what I'm going to do. So my specialty rotations were radiology, orthopedics, cardiology, neurosurgery, all those kinds of things, because you need to know those things to practice in the emergency department. You're reading CAT scans, you're reading x-rays, you're treating trauma patients. It's a whole, at ECMC in the ER, the APPs, the advanced practice providers, are seeing everyone.
Wow.
You see all comers, no matter what comes across you. Mind you, if you're in the trauma room, you are surrounded by the trauma service. So, but still, you are expected to be able to do all the procedures that come across your path.
Wow.
So, it's important to be well-rounded in that setting. But after doing it for 2 years, this position came up 2 miles from my house.
And you had to take it.
And the interview went really well. And I suddenly realized this is something I've wanted to do since I was 5.
Oh, beautiful.
When you like taking care of people, sometimes the transiency of the ER lacks that connection.
Yeah.
And you always wonder what happened to who you treated. And
Don't
you never
cry.
got that feedback. I know. I'm really trying not to.
If you cry, I'm gonna cry.
I'm trying not to. I'm doing my best. I can be a bit of a weepy girl sometimes. So I, thought, well, it's time to get out. And I was pretty crusty in the ER.
Yeah.
And you have to be, that there's that humanity that you have to protect for years. And it's a very thick crust. And I realized how thick it was a year later when one of our team members in the emergency department. He was a PA, and his son got very, very sick and was being treated at Memorial Sloan Kettering. And I was asked to take some per diem shifts in the emergency department to cover him. And the first day back, one of the first patients we had was a cardiac arrest. And we spent, a little over 30 minutes trying to resuscitate the gentleman. He was an elderly man, and the resuscitation failed. And so I went over to Fast Track to pick up the patients that had been given to me, and I had x-rays to follow up on. So I was walking through the back hall, which passes the what we call the quiet room, where we do death notifications. And so I was headed over to x-ray, which passes that room. And all of a sudden I heard, because the attendings do the death notifications. So, I heard all this screaming and tumult, and it started to well up, and it just, you felt that crush in your chest kind of thing, that sadness. And my thought that went through my head was, a year ago, the thought would have been, why do they have to be so loud? Because that's your crust.
Yeah.
Trying to protect you.
Right.
And protect your humanity.
Because you can't be soft.
You can't.
Yeah.
You have to be able to keep moving.
Yeah.
And it's thick and it's awful.
Yeah.
And there's no explaining that sometimes. To people who aren't in there,
who
aren't in the trench.
Imagine. And I couldn't even imagine you being hard. Like,
oh, this is me now.
Yeah.
You know what I mean? Like, I did trauma centers all over the country for 27 years. Wow. I mean, Brownsville, Texas, Houston, Texas. I was in New Haven at Yale. I just I did a lot of things in those years.
Yeah, I did have some questions here about your ER stay. I can't even imagine. I mean, I see, because I'm a patient, know, I get blood drawn and I'm queasy, so I couldn't even imagine having to go through. But when did you? So I guess this is when you probably decided when family practitioner versus ER was better for you. So I personally feel like family is better for you.
Yes, because it's better for me, heart and soul.
Yes. I personally, I don't even know. Like I said, I couldn't even imagine you being hardcore because you're such a sweetheart. It's like I couldn't even imagine. But you had to do what you had to do. You had to protect yourself. How you say you were in the ER for about 27 years? Wow. Wow, that's a long time.
Because I graduated in December of '84, and then I moved to Brownsville with a suitcase and knew no one, because they showed me a hospital with palm trees on the front lawn, and they said Mexico was right there, right at the border, and the Gulf of Mexico was 20 miles away, and beautiful beaches.
Vacation spot.
Girl, it was February, and I was climbing over snowbanks coming off the TTC bus in Toronto, and it was, I gotta go. And it was $8.13 an hour.
Oh, wow.
Yes. I spent 3 months on a med surge floor and then transferred down to the emergency department. Yeah. Wow. And I'll tell you, I spoke, pidgin French, because in Canada we spoke, I'm Canadian, right?
Canadian,
so we spoke pidgin French, and I spoke no Spanish. I had little Juanita patients, little grandmas, and some of the nurses teaching me my Spanish. Aww. They taught me swear words first, so I knew when I was being yelled at.
Of course.
And cursed, because that would happen. They would curse you if you said,
said something wrong, or
or disrespected their cultural beliefs. Like if they told you they were seeing, if they had seen a witch doctor, say a bruja blanca or a bruja negra for herbal medicines or something like that. I mean, your best response to them is, okay, we'll continue to take that, but take this too.
Okay.
Because if you disrespected what they had and tried to tell them stop taking that stuff, they're not going to take
They're
what
not
you
going
give
to
them
trust
either.
you. Right.
Right. So you had to understand
Different
cultural negotiation.
Mm-hmm.
And you had to learn Spanish. And thank God I had that pidgin French background, because some of the language is similar.
Right.
So it made it easier to learn. But one funny story I had, when I first went down to the ER, I had a gentleman come flying in the triage doors, and he's standing in front of me, and he's yelling, "Chicken breath, chicken breath, chicken breath." And I'm like, chicken breath. So I got up really fast and I ran and I got the charge nurse, Marcella. And I said, "This man out there is yelling, chicken breath, chicken breath. I don't know what he's saying." And she goes, "Chicken breath?" She walks outside with me and the guy's yelling, "Chicken breath, chicken breath." Marcella looks at me and she goes, "She can't breathe. We need to go get his wife."
Oh, I'm like, what? Chicken. Okay, well, I get that.
She can't breathe.
She can't breathe. Okay.
Yeah, and I'm just like, so we don't. The story behind that and the purpose I share that for is really as a culture who says you need to speak English first, and blah blah blah. Right. English is the toughest language to learn.
It is.
Let's figure that out first. But you need to, when you're listening to another culture who speaks another language, when they're speaking English, slow down your own brain and
understanding
listen.
is key.
When you slow down your own brain and listen to what they are saying, you will understand the language and through the accent.
Yeah.
It's because people don't slow down.
So that's another thing about doctors.
Yes.
And nurse, the professionals, we'll say that, medical professionals. Me in the African American community, we don't really trust. We have a issue with trust.
Yeah.
And I mean, I can understand why. We had the Tuskegee experiment.
Yes.
We had a lot of different things, but we have to understand that was then. This is now, but it's still hard to let go of those things for us, and understandably, but. You have to, your doctors, your nurses, you have to learn how to communicate. And unfortunately, nowadays, a lot of doctors don't know that.
Right.
Because of the fact that I think it's because this is just my, views. You only have 15, 20 minutes in a room. And me and you take a half an hour sometimes. We have to, there's some things that you just can't breeze through.
Exactly.
You have to listen.
Yes.
You have to really understand.
Yes.
Because if you don't, then you're skipping. They're not going to get to the main issue.
Exactly.
Because we're going to say so much, but it's an underlying issue.
Yeah.
That
it's what's between the lines.
Absolutely.
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 It's the body language, the facial expression.
Yeah.
There's a difference in the way both styles communicate. There's not a lot of direct eye contact, and that can be interpreted as dishonesty.
Yeah.
And it's not. It's deference.
Yeah.
And it's just, you have to understand that.
Yeah. And I've seen a lot of Indian doctors. And the women and the men are completely different. The women are more faster and and the men, I think they don't. I think they have a little problem speaking with women respectfully. So in
they're
most
bossy.
They're very bossy. And most in this neighborhood, in this area, most of the doctors are Indian. I'm noticing a lot of them are Indian. So it's hard. It's hard for us to trust people that don't look like us. I'm going to be honest. And that's one thing about us. We are always honest with each other. Yeah. So it's hard for African American people to trust people that don't look like us.
I have a lot of patients who come to me to get explanations for what their specialist told them, because they don't want to ask questions because they feel rushed. They feel, the visit was impersonal. They didn't have time to ask questions, or they didn't feel that a question was appropriate. Right. And it makes me crazy. It does. Literally makes me insane.
I mean, now that I know better, I do better. But it's a lot of us that just don't know.
Right.
And
it's
if you
tough
don't
to
know,
advocate.
it is. That is one thing that I've learned out of most people that watch or listen. They know my story. They know how I've become an LVAD patient, or how I've congestive heart failure patient stemming from PPCM. But I did not advocate for myself when I was pregnant. I did not know. I had no idea what PPCM is or was or anything like that. And usually you don't know until it's too late. And that's why I personally have been very active in my community and things of that nature, so I can educate other people on things that is different, that you wouldn't even think about, that you wouldn't even know about. And if I can do one thing, is advocate for yourself, then you when you go into the doctor's office or nurse's exam room, you'll feel better knowing that you came out with some straightforward answers, if nothing else.
Yes.
And I also tell people to write it down.
Yes.
Like, write it down, because you just never know what you're going to miss in the conversation.
Yes.
Or record it on your cell phones.
Right.
Like, we have a computer in our hand.
Right.
If you don't know what it is, record it. You don't know the word, go back and do the research so you'll know. So I'm very big on advocating for myself now.
Yeah.
But not
and
before.
This is what I love about patients having access to their records, so that they can read. And, I will have patients look at their consult notes. I will share consult notes with them so that, and go through, this is what they said. This is what the plan is, especially if they said to me something. I will ask a patient, what do you understand of what the specialist said to you? And if it's something completely different than what I read and what I understand to be the plan, oh, no, girl. Come on in this room. Yeah. You're going to come sit with me. We're going to review the consultant's plan, because you got this completely backwards.
Yeah.
So,
and people just don't know. Like, for instance, I've been reading all over the internet where lisinopril is not a good drug for Black people. So I've been reading. I've been on lisinopril probably for the last 4 years, and I haven't had an issue. But as soon as you say something about lisinopril to a Black person, they're like, "Oh, you can't take that drug," and that's because they've seen it on the internet, where some people have tendencies of doing different things. Everybody is not the same.
There are a couple of things that do happen with African Americans with lisinopril specifically, and that's the angioedema that can happen, the lip swelling. They can develop a cough. But that's 1 to 2 people per 500 to 1,000 in those cases. And they're not, angioedema always is scary. Okay. Out of my 27 years in the emergency department, I have seen multiple, probably 100 cases of it. I have never seen anyone lose an airway as a consequence of the angioedema, which is a risk.
Angioedema is the swelling of your mouth and throat
and tongue.
Oh, tongue.
The tongue and lips. And generally, when your lips start to swell, you're in the ER.
Yeah.
I mean, that's absolutely no joke. Generally, people don't wait.
Right.
Okay. And then sometimes the tongue involvement will happen. But I've never had anyone actually lose their airway. And the treatment is Benadryl and steroids.
Right.
And you stop the lisinopril. And it can happen with antibiotics. It can happen with a bunch of medications. Yeah,
I get it.
And when it happens, we treat it.
Yeah.
You take 50 milligrams of Benadryl and then you go to the ER.
And that's a lot of people. Benadryl to me is like a wonder drug.
I know. Because it's like aspirin.
Yeah, it is. It really is. It cures so much. I remember when I was taking antibiotics. and I'm allergic to antibiotics.
Mm-hmm.
And we found that over time. You know, we didn't know. So
I just had my first allergic reaction probably 6 or 7 years ago, where I almost lost my airway driving myself to the hospital because I didn't want to call an ambulance. I was an idiot. I should have.
I did the same thing.
Literally. So, yeah.
When I went into whatever it was, that I didn't go into cardiac arrest. I didn't have a heart attack. I just had I don't even know what to call it anymore. When I was having a heart complication, I guess. When I had that, I was sweating profusely. My heart was beating crazy. I thought I was having a heart attack, but I also thought I was going through postpartum depression. So I'm like, I didn't want to leave it was my first day back at work. You know, I didn't want to leave my baby at home with her dad. I didn't want to go to work. So I thought, oh my God, you know, this is postpartum depression. Because you see it on TV, you see all these things, and you automatically think that's what I'm doing, or that's what I'm going through, or that's what it is. And you're not a doctor, so you need to see a doctor. But I drove myself to the emergency room, and they were like, "You did what?"
Yeah. You drove yourself here?
Yeah.
Seriously? Yeah.
And I was pretty much like walking in dying.
Yeah.
And they were like, "Oh my God!" Like it was really scary.
Yeah.
It was really scary.
Yeah.
But going back to the ER, what was some of the worst? What was the worst thing that you've seen in the ER?
Okay. So a lot of them involve trauma, and some of them, like, again, this is a situation where we could be here all day. I had a gentleman who was brought over from Mexico with the Cruz Roja. It's called the Cruz Roja. Okay, the Red Cross.
Oh, wow.
In the back of a Pinto. Do you remember Pintos?
Oh my goodness, those small cars, right?
Yeah, it was a hatchback Pinto.
Oh.
He'd been hit by a bus, and somehow they had determined that he was an American citizen. Losing my battery.
Oh no. I don't think I have a charger with me either.
Yeah, me neither.
You do?
Okay.
No.
Yeah.
Oh.
Okay, that's all right. I'm going to be going away soon.
Oh.
I'm low power. So anyway, so this gentleman came across, and he literally had like a letter Z laceration across his forehead. He was unconscious and intubated, so he had a tube down his airway. He had a nasogastric tube in his nose. He had 2 chest tubes in his chest for lung collapse. He had a Foley catheter in his urethra where he urinates from to drain urine.
That's the worst.
And at that point in time, we had a CAT scanner that was in a truck, in the back of a bed of a truck, like a 18-wheeler.
Oh my
what are those called?
Yeah, 18-wheeler, the big.
Well, yeah, they used to travel hospital to hospital a week at a time. So this, this is what we had for our CAT scanner. So we took the gentleman to the CAT scanner to find out what was going on possibly with his brain, because he was unresponsive, not responding to any stimuli whatsoever. We had to re-intubate him because the balloon was actually not fully inflated. It had a leak. So he basically was not oxygenated in the back of this Pinto the whole time he came across. So we had to re-intubate him on arrival. We got him over to the CAT scanner, and we scanned him. And during the scan, the films were coming up, and we realized that the nasogastric tube that they had inserted into his nose had punctured what's called the cribriform sinus in the back of the nose and gone into his brain and was coiled up in his brain. So what they had been sucking out through the nasogastric tube was actually his gray matter from his brain.
Oh my goodness.
So that in and of itself was one of the first worst cases I ever experienced.
Wow.
And another case down there was a gentleman who actually drove himself to the ER ambulance bay. And when he stopped his car, he collapsed and onto the horn of the car, thank God.
So somebody,
because that's how we realized someone was out there. And we went out to pick him up, and he literally was full of gunshot wounds. The entire side of his car, it was a machine gun that hit him, because the entire side of his car was just riddled with bullet holes. And we brought him in, and he had over 56 wounds.
Oh my goodness.
And he was taken to the OR and he died. But just incredible.
Wow.
That he drove himself to the hospital.
He must have been on pure adrenaline.
Yeah,
like,
absolutely.
Wow.
Absolutely. No idea
nuts.
How he made it there.
That is absolutely crazy.
So, yeah.
56 wounds.
56 wounds. Yeah. And the car, like I said, was just riddled with holes.
That is crazy.
So,
all by itself.
Yep. We had another gentleman when I was at Yale who was intoxicated. And I don't mean to laugh, but the story is just incredible. He was intoxicated and refused to pay for his Chinese food at a restaurant. And the chef leapt over the counter with a cleaver and hit him on the head. Dead center.
Oh, wow.
Dead center in the head. And the gentleman came in talking, wide awake, talking, answering everything that we asked, wide awake, alert, oriented, cooperative, as drunk as he was. He was collared and on a
the alcohol probably helped.
Yeah, it probably did. He never complained of a headache, I'll tell you that. But we took him to the CAT scanner to find out how big is this cleaver, how far does it go?
Right.
And it went right down between the hemispheres of the brain and stopped literally millimeters from what's called the circle of Willis, which is the basis of the blood flow to the brain.
Oh my goodness. So thank God they didn't hit that.
How they didn't
is beyond you and me.
Had someone even accidentally bumped that cleaver, it would have been lights out for him.
Oh my goodness.
But it missed everything. I mean, literally with surgical precision, that thing went down through the middle of his head.
Wow.
Yeah.
That is crazy.
Yeah. So I think that
is crazy. I guess that it would be.
And the only other
I could never.
Yeah, the only other scary thing that ever happened was a guy running down the hall with a gun in his hand at ECMC trying to chase another shooting victim in the OR, trying to find the operating room to finish the guy off.
At ECMC?
Mm-hmm.
Wow.
Mm-hmm.
Wow. I don't think I could ever work in the medical field.
I do have one other funny story.
Okay.
My mother used to listen to a scanner.
Uh-huh.
And I was working 3 p.m. until 3 a.m, and I was working triage. And I was sitting there talking to another paramedic, and the shooting got dropped off on the ramp. You know, that happens all the time.
Yeah.
They drive up, they throw the shooting out the door, and they take off.
Oh my goodness.
So the paramedic radioed, shooting at triage at ECMC, I'm going to be out. And so we took the patient to the trauma room, got everything started, took care of the patient. And I came back to triage, and I was all settled down. You know, it's 2:00 a.m. And I turned to the paramedic and I said, I'm going to call my house and I'm going to listen to my voicemail, and you're going to hear it too. And I said, and what you're going to hear is my mother calling me to see if I'm okay.
Aww.
And sure enough, called my house, and there she was. Hi, honey.
Aww.
I just heard on the scanner that there was a shooting at triage. I want to make sure you're okay. Because then she heard all the other cops ringing in, shooting at triage at ECMC, because they heard what the medic said.
Yeah.
So there was like 20 cars
Wow.
at the county, because when we came out, we were crawling with cops because they thought it was a shooting at triage.
But it was an actual person that was
a victim
already
that was
had been shot.
Yeah. So, hi, honey.
Oh, that's so sweet. Mama bears, you know those. I'm a mama bear.
Gosh.
You're a mama bear.
But she called my house. Like.
Well, she didn't want to interrupt you at this
exactly. Yeah.
That's so sweet.
How are you going to find out I've been shot if you're calling my house, Mama?
That's so sweet. She knew what she was doing.
She did. And that's why I wear her ladybug symbol, ladybug.
Absolutely. So why, I know this is crazy because you are a doctor, my doctor. Why are doctors the worst patients?
Oh. Listen, we're all the worst patients, not just doctors, but doctors, they know enough to know all the frightening things that can happen.
Right.
And for me, from a nurse practitioner standpoint, even from a nurse's standpoint, I hate needles. I used to have to lay down to get a PPD, like a TB test. That needle is so tiny. It's not funny. I now give myself a shot once a week for my diabetes, for crying out loud, and I do it fine. But I mean, there was a time where I would quiver like an idiot because I know I can start an IV on the worst of drug addicts and get blood from them without issue. I know I'm good at what I do. People come to get me to start their lines if they have a hard time. I don't know about you coming at me with the needle. Are you good?
Are you good?
Are you good? And I will tell you this as well. Quite frequently, when it comes to a physician needing treatment in an ER, even I will miss that first IV. It just happens. I don't know what kind of karma it is. I don't know. It's not intentional. I can promise you that. But to have to walk into a physician's room and start their IV, there is nothing more anxiety provoking.
Yeah.
And it's not like they know how to do one. They know I've done 100 million.
Yeah.
And they've done 5. You know what I mean?
Right.
Like it's not their wheelhouse. It's my wheelhouse. But
it's just scary.
It's scary.
Yeah, I get it.
So, and it's a control thing as well. There's no more powerless position than that of patient.
That is very true. Because you just feel like no matter what you do, you can't make it right. So you're
one of the best things you can do as a provider is hand some of that power back and give the patient options.
Wow.
And make sure they understand that there's options.
Yeah.
You don't have to do what I tell you. You don't have to do it how I tell you. I can give you 16 ways to Sunday to do the same thing. But we're going to come to the same conclusion.
You're going to do it either my way, which is probably the quickest and the less painful, or you're going to do it your way, which... Yeah. And my doctor, when I was my cardiologist, I went to Strong Memorial Hospital. And I was 30 years old and I had just had London. So it was like 6 months after I had London. And he told me I needed the LVAD. And I was so terrified.
Oh, yeah.
But he gave me a number to a young lady. And I actually met her this past weekend for the first time ever.
I saw that post.
Yeah. And she was wonderful. And she said, he told me to call this young lady, talk to her, about the LVAD, talk to her about her life, what she does, So it made me feel a little more comfortable. He was like, then we'll discuss it again in the office. And I was like, okay. So the next time I went to the office, he was like, did you do it? And I was like, yeah. He was like, so what do you think? I said, I'm not doing it. I said, I'm not doing it. I'm not doing it. I was only 30 years old. I had just had a baby. I thought that I was cute. I thought that, I just was not ready for that.
Yeah.
And he was like, okay, so we'll put you on some medicines. And that's when I started the lisinopril and a lot of different other. I was on about 30 pills. And he was like, and if the heart gets stronger, then great. My EF fraction at this point was like 15. So if the heart gets stronger, yeah, it was bad. It was really low. It was really bad. A normal EF fraction is what, 65?
55. You wanted at least 50 to 55, and then a little bit better would be great. But
yeah, so mine was at 15%, and I refused to get the LVAD because I was cute.
Yeah, I was cute.
I was cute, and that was the only real reason that I can say that I didn't want it. It was like, it was scary. It was really scary. But it wouldn't have been normal for me. It wasn't a normal lifestyle. I would have never been normal again, you know? So I didn't want it. And God does mysterious things because he had me on a medication for about 10 years. My EF fraction went to about 20%, but that was it. Never got over 20%.
Nope.
Then I went into the hospital to get my defibrillator changed, and I coded on the table. I woke up 2 weeks later with the LVAD, and I'm like,
you got it anyway.
Like, I'm back. This is what it is. This is what it is.
Yeah.
Like, now I'm like,
and the one in the hospital is like a stand-up air conditioner.
It was huge. Yeah, those were huge.
Yeah.
But
that's what I'm accustomed to using.
Yeah. So they were completely different. Thank God that now they, even within those 10 years that I had was on the medicine, they had changed them.
Yes.
So even, the
portability is incredible.
So now I'm like, oh, this is nothing, like, we could have did this 10 years ago. This is easy work, Yep. But I was so terrified because I was like, how am I going to dress with this? Like the little things. Like you think about the littlest things. Like, I'm not going to be able to do this. I'm not going to be able to carry my baby and carry the LVAD. I carry my grandson around all day now. Like, it's nothing.
Yes.
But it's the little things sometimes that stop us, from doing what we really need.
It's the fear of the unknown.
The fear, absolutely. And I was terrified. A lot of times you go to the doctor's office and you see these posters on the wall, and they're very intimidating. And that's what it was. It was. I was at the cardiologist and he had an LVAD poster. And he was like, "This is what it is. This is it." And I'm like, "I'm not getting that. Like, what, are you crazy, man? Like, do you see me?"
Yeah.
Like, no.
Yeah.
But
I don't have a bag that matches that.
I don't have a bag to match every outfit. Like, now I do. But and that's one thing about, I definitely dress it up because that's a woman type thing. That's what we like to do.
That
we like to dress up.
Accessorize.
Yes, absolutely. And that's what I do with my LVAD. I different colors, different bags, different Gucci, Prada, Chanel, all of that.
Exactly.
Coach.
Yep.
Tommy Hilfiger, whatever it is that I'm wearing that day, I try to match it up with something unique. Especially if I'm going out.
There you go.
I like to, dress it up. But it's a little thing.
That's what you should ask for donations for too, for your patients that come into your group.
Oh, another person was like, I should design bags. And I was like, you know what? That would be super cool to design LVAD bags. But I wouldn't even know how to start. I'm like, I don't even know what to do.
Well, there's also that program, I believe, at Buff State.
The business program.
There's a design program.
Oh, really?
Absolutely. If you go, I think on September 29th or 30th, there's a FIG fashion show. And there are artists there who are designers.
Oh, wow.
Go there, bring up your idea, see if anyone's interested in biting.
And that's 29th.
It's on 29th or 30th, I think, in the evening.
Oh,
and it's at the Seneca One Plaza. I don't know if I should be plugging this on. I'm good. They don't know me. I don't know them. But, I have been hearing this ad nauseum on another station. But, yeah.
Cool.
Yeah. And that might be something that I would tell you should stick your head in, because if you've got interest in doing something like that, there might be someone who's interested in teaming up with you.
Yeah.
to
Yeah,
make these bags.
That would
And
be dope.
yes, absolutely. And there's nothing wrong. This is something I've taught my daughter, and I teach my patients, I teach my kids, my pediatric kids, the teenagers that I see, I lecture anyone and everyone. Never be your first no.
That's
okay?
smart.
Never be
'Cause we
your
do that all the
first
time.
no. And then don't take the next no you hear either. Go to the next person. Don't
That's
stop. If you've got something you are passionate about,
Right.
go for it.
Yeah.
Chase it down. And for God's sake, stay out of your own way.
Yeah.
If you find
I do
yourself
that
getting
a
in your
lot.
own way, you're not going to achieve the means to an end.
Mm-hmm.
And that's what I tell my kids. It's what I told my daughter. It's how I raised my daughter. And now she's, carrying around a machine gun.
She's a boss.
So, but it really tells you that you can't succeed if you don't take the first step, if you don't ask the first question, if you don't lean in and listen, you can't succeed.
This is why I don't see you being hired at all. Like, and you have just won an award. Tell us about the award. Tell us.
Oh, that was wild. So in June, end of May or beginning of June, I got a letter saying I had been nominated by students and faculty at SUNY Upstate Medical, where I had taught the clinical pathology class. And I had been teaching as well in what it's a Typhon program where you have to evaluate student notes, give them feedback on their notes, on the patients that they've seen. You also evaluate them via video, via video when they do a fake patient scenario, say, and you give them feedback, criticisms on that. I always had communication with my students as the cohort that was assigned to me. At the beginning of the semester, I would always have a little meeting with them to say, listen, this is me. This is what I expect. This is what I don't expect. I know you may have other professors that expect other things, but this is what I want you to see you learn. This is what I want to see you achieve. And this is how I want to see you succeed. And so apparently that got me an award.
They loved it.
So they got me nominated anyway. So they said that they were going to be debating the winner of this award based on the nominations, and it would be by the end of the summer they would announce the winner. So I didn't expect anything, nor did I expect to hear anything. But I didn't check my email for a couple of weeks, or at least, and so I had like 700 emails in there, and buried in there at the end of June, this was mid-July, was an email saying I had been
You won.
awarded this teaching and excellence in teaching, voluntary teaching position, because
that's
it
excellent.
was
Congratulations.
amazing.
That is excellent.
Yeah. I was very humbled. I was surrounded
Yeah.
by PhDs and doctorates and people with tenure, and here I am, this amazing master's teacher
woman with so much wealth and knowledge and such an communicator. Like, that's what it is about me. Like, I'm a communicator.
Yes.
So I love when I can talk to someone, like, just regular conversation. I don't want you to be using big words with me. I need to know where you're coming from. Why is it this? Why is it that? And that's why me and you have always clicked.
Have I drawn pictures on the
absolutely, absolutely. This is what this is, and this is what that is. Draw the pictures, because I don't know what area in my body you talking about. Yes, she draws pictures for me. Yes. Yep. Yes. And I go into sometimes, because of my situation, I go into doctor's office and they're afraid of me.
Mm-hmm.
And I understand why they're afraid, because
yeah.
we live in a world nowadays where lawsuits are just thrown frivolously.
Yes.
So, if they do something I don't like, easily, I'm gonna sue them. That's
right.
how it is. But you have always been this woman that, like, I hate to say a strong woman, because it has this disposition about it that you're not soft. And nowadays they're these, you got to be strong, but you got to be soft.
Mm-hmm.
It's the strong woman
Mm-hmm.
era, or soft woman era nowadays.
Mm-hmm.
And you are both. You are strong and you are soft. And I love that about you. And you're so educated and so well versed. And the way you talk to me and the way you make me understand things. And I appreciate that.
Absolutely amazing.
Hi, Crystal. Yes, Crystal is another one of your patients, and she said that you're absolutely amazing, and you are.
Oh, thank you.
And we need
Crystal.
you to know that. We need you to know that. If you guys out there have any questions for Lisa, please send them in the messages, send them in the text, so we can ask her some questions. Last January, we watched Damar Hamlin go into cardiac arrest on the football field.
Yes.
Couple months later, almost 6 months later, we saw LeBron James' son also go into cardiac arrest.
Mm-hmm.
What is the difference between cardiac arrest and heart attack?
Mm-hmm.
And why do you think so many people nowadays are going through this right away? Like at a younger age, I guess.
Mm-hmm. Mm-hmm. So Damar Hamlin situation was a situation of timing.
Mm-hmm.
He was struck in the chest. I wish I had a board to draw you a picture, because this is a picture scenario to understand, because you have a rhythm, an electrical rhythm to the heart, where there's a P wave, meaning the atria, the top of the heart beats, and then there's a pause, and then the QRS goes off when the ventricles beat, right? Mm-hmm. And then there's a rest when the heart is resting and filling, and then there's the T wave when the heart is full and getting ready to start the whole process again. The P, the atria fire, the ventricle fires. When things happen during that rest period, which is when Damar got hit, it can start ventricular tachycardia or sudden asystole, which is what happened with him. Mm-hmm. He collapsed and his heart stopped. So it was a matter of, the atria had just fired, the ventricles were filled and resting, or had just ejected and resting. One of those 3 pause second milliseconds of time. And that was exactly when he got popped. And down he went.
That was so scary to watch.
Yes.
So
absolutely. But the thing is, the timing of his rescue was what was key.
Absolutely.
And in every cardiac arrest, time equals brain and heart muscle.
That's why
survival.
You're right. That's why it's so important for people to know CPR.
Yes.
Again, something I am advocating for, CPR training.
Yes.
All the time in the schools, at the games, at the football games, the basketball games, soccer, tennis, wherever.
AEDs available.
AEDs available everywhere.
Yes.
You always need to have someone there. And I don't necessarily know if that's what's going on right now in Niagara Falls school systems and things of that nature. Mm-hmm. I know that they do have AEDs in the schools, but I don't know if they have them outside at the the practice fields. Mm-hmm. I don't know if they have them outside at the game fields and things of that nature. So that is something that me and my business is trying to fight for. Mm-hmm. But it is super important. And when I was doing some studying, I noticed that unfortunately it goes back to race. African American people are less likely to get CPR because they're scared. People are scared to touch us. Like we're some doll that you're, like they're scared to touch us. Unfortunately, it's a race thing. It's definitely a race thing. So we as African Americans need to know CPR. That we need to know where in your job, need to know where the AED is.
Yes.
Because you might be the one that has to save your brother or sister. Because a lot of times other people will not.
Well, they also may think of the old CPR where you had to give breaths to someone's mouth, and we don't have to do that anymore. We don't have to do that,
right?
Absolutely. It's the circulation of blood that is incredibly important. Right. So there is no more mouth to mouth.
Right? So, resuscitation.
Yes, exactly.
So I know Damar Hamlin was doing the "Stay Alive" campaign with the song "Stay Alive," and that's how they rhythm the punctures of the heart. So that was good. That was really good. And I hope that I know that because it was on a wide range on television everywhere, everybody knows about it, that opens up a lot of conversation. So that's what I'm hoping and praying. And my business, Strong Heart to Soul, hopefully we're going to work with some people in our area to get everybody CPR certified and things of that nature. But what is the difference between cardiac arrest and a heart disease?
Okay. And cardiac arrest and
heart attack. I'm sorry. I said disease.
Cardiac arrest is when the heart stops and there is no more blood flow whatsoever. Okay. Nothing is functioning. Atria are not firing. Ventricles aren't firing. Everything is stopped. Okay. That's cardiac arrest. A heart attack is when some portion of the heart is not getting oxygen. Okay. So that portion of the heart causes pain. Now, if you're diabetic, you may have jaw pain. You may have shoulder pain. You may not have chest pain or pressure. Okay. It's quite frequently explained as if it's very severe, it's a crushing sensation. It's a heaviness. Someone's sitting on my chest. There's an elephant on my chest. It's a heavy pressure. It's a dull ache in my left chest. It goes up into my shoulder, up into my neck, up into my jaw. Oh, wow. And quite frequently, like I said, in diabetics, they may not have the typical presentation. I've had 74-year-old woman I had one time came in with jaw pain and a toothache, and she was convinced she needed an antibiotic for a toothache. And we did an EKG on her because she was looking a little peaked and she was having a heart attack. And we had to fight with her. It took us an hour to convince her she was having a heart attack. Wow. Yeah. So, things can present very differently. And you just have to be
men and women too.
Yes. Men and women can be acutely different. Women will quite frequently dismiss things as menopause. I'm having a hot flash. I'm just having a hot flash. And I'm feeling this fullness in my chest because of my hot flash. Wow. And you're sitting there going, no, honey, you're dripping from your forehead. Your pressure's 90. And you're pale. Most hot flashes are red as a fire engine.
Yeah. So I notice we take care of everyone and don't take care of ourselves.
Of course.
I learned after my situation, we have to fill up ourselves before we can pour out to anyone else. And we have to check that constantly for women, because I notice even now after I had my surgery and I got together and I was better, I was home, people laid off me for a little while. They let Fatima rest,
Yes.
They let Fatima do her thing for a little while. Well, now it's 4 years later and Fatima's, feeling good, out doing her thing again, living life to the fullest. But people are starting to call, are starting to ask, are starting to, can you do this? Can you do that? Can you do this?
Get in your business.
Yeah, they all in my business. And I am not a no person. So I kind of say, yeah, I'll do this, or I'll do that, or I'll do that. And then I'm wearing myself thin again. And that's, you can't do that. No. You have to learn self-care. And you have to check yourself on your self-care, because it happens slowly but surely, where people start to, and I don't just want to say people, I just want to say you stretch yourself thin. Yes. And you have to bring yourself back to you. Yes. Especially moms. We try to be there for the spouse, we try to be there for the kids, we try to be there for our parents, we try to be there for everyone else. Friends, sister, cousin, brother, sister, whatever. Yeah. We have to be here for ourselves, because if we don't fill ourselves up, we can't pour into these other cups. Yeah. So I'm learning. Pour
from an empty cup.
Yes, you cannot pour from an empty cup. So I am learning slowly but surely. I learned before, but I got to get back into me, because it's a time you got to check yourself. You got to check yourself. Why do you think we're seeing more cardiac arrest in younger people now? Or, I mean, has it always been that and we just didn't know about it? Or is it just because it's the internet and TV? Or what do you think is going on? Because I've never noticed it before.
Yeah, no, I haven't noticed that much of an uptick in general. You know, I think it's in the press a lot more. Yeah. And we're hearing a lot more relative to drug overdoses that are happening, and fentanyl that's everywhere.
Oh my goodness. What does fentanyl do to you? What does it do to your
fentanyl
body?
Is one of the strongest opiates on the planet. And then, carfentanil came along.
What is carfentanil?
Carfentanil is so dangerous, it's not even funny. Carfentanil, let me just put it to you this way. If medics or police go to a call and it's suspected that carfentanil is there, they want to be in a spacesuit to even go into the scene, because it takes 2 or 3 flakes of that stuff to knock an elephant down.
Oh my goodness.
You know, and that's literally what it's used for. You know, these are drugs that are used in anesthesia when someone is intubated and their airway is controlled. Fentanyl, we never used to use fentanyl unless you're intubated. Okay. Now it's used in the post-op setting, you know, but it's microdosed in the hospital setting. So, outside on the street, you have no idea. Even if it is your plan to go out and buy some fentanyl on the street, you have no idea what you're doing. You don't know how much you're getting.
I don't even understand why would people want to buy I don't get it. Like,
because it's an opiate and they're addicted. So it's not a matter of, it's no different than heroin. It's cheaper. In that difference,
it's scary,
but it's killing people.
It is definitely killing a lot of people.
So, and they're trying to find a lot of interesting ways to. I was listening to a case the other day about a gentleman who was doing drugs with his friend. His friend died in the driver's seat of the car, and he did CPR on him. And I can't remember what state this was in. I want to say Tennessee. And this guy that did CPR on him is now doing life for murder, because he was the one that actually paid for the drugs that the two of them did. And he's now in prison for life.
It's very sad.
Even though this guy accepted the drugs, had been always doing drugs. It was his habit.
I don't know. It's very crazy, because now I see where like they're having tents put up places for drug addicts can come and use a clean needle and then go on about their day or something. I don't really understand it. Like
safe use sites,
safe
have Narcan available. If someone collapses, they're not going to die. So it's a life-saving approach to something that's going to happen anyway, but unsafely. This is the way I look at it. You know, everybody says, you know, they've got that whole NIMBY approach, not in my backyard. You know?
Yeah.
Well, I'm sorry.
It's happening in your
There's
backyard.
people in your backyard using heroin, using fentanyl, using IV cocaine, using all of the other drugs that are available to them in your backyard. And selling it in your backyard to your children.
Yes.
So if you don't want your children in a safe place to use drugs, fine. That's your business.
It's so sad. It's so sad because a lot of kids. I don't know if you heard about this over last week, maybe a daycare center in New York City. 3 kids got very sick because it was fentanyl in the home, and 1 child died at a daycare center.
Yeah,
like
somebody's dealing outside of the house where there's children there. Yeah.
Yes. And one of these poor babies died from this stuff.
Yeah.
Like, how could you?
It's heartbreaking.
It's super heartbreaking. Like, it's just, I don't really know what to say.
But they'll do their time, Tima. They have to do their time. And they need to be punished to the fullest extent of the law.
Yeah. Yeah. Because that baby did not have to go. And that you should know better than that. Like, my goodness.
Exactly.
My goodness. I know that the numbers are up now for COVID.
Yes.
What are we telling our friends and family, and what are you telling your patients about it?
I just got my vaccine last night.
Oh, did you?
Yep.
Yeah, I've had all of them.
Yep. This is my 6th one.
Yeah, I think I had 5. I haven't had the last one yet.
Yeah.
But definitely, I don't know. There's so many people out there who are talking bad about it, I'm not going to get this shot and I'm not going to do this.
For heaven's sakes, everybody got their childhood vaccines and they are perfectly fine, for crying out loud. You know, it just amazes me, the pandemonium that was caused by all of the misinformation relative to these vaccines. When this technology has been out for 20 years,
time, right?
20 years. And it took putting all of the right scientists in one room, and they were told to settle the issue. Get us a vaccine. This is a worldwide pandemic. And they did it.
And they should
only
be celebrated
to be
for that.
Vilified by people who can't even read a research paper.
Crazy.
So
it's scary.
And yet people are willing to take that information from people who can't read a research paper and claim it to be true.
Yeah.
So I just for a long time I really, would argue with people, not my patients. I mean, I tried to have those discussions in a very civil manner. And then I just stopped.
Yeah.
Because
it's up to you.
It's your choice. You do you, boo. I'm going to educate you.
Because that's what I'm here to do.
That's what I'm here to do. Yep.
And after that, it's on you.
And the choice is yours.
Yeah.
So I'll see you on the other side of the ventilator.
All right. And that's very sad.
And I hope that doesn't have to be the case.
Right. Absolutely. I've seen some really sick people.
Yeah. And, but the sad thing is, they're saying, oh, this person, that person, this person I know, got a cold and it was COVID and it was just a cold. And I'm like, okay, well, those are the lucky people. You, on the other hand, have diabetes, hypertension, and hyperlipidemia, and
Yeah, and it's
COPD.
not really
So COVID for you
could be
is
fatal.
a fatal death
Yeah,
sentence.
that's
So
why I was complaining with my
yeah,
everybody looking at me crazy because I got on my mask.
yeah.
Y'all can look at me crazy all y'all want to. I'm wearing mine.
Yeah, and they just don't understand that the vaccine essentially is injecting you with a recipe.
Mhm.
Hello, it's a recipe. That's all it is. It's
I remember-
teaching your T and B cells how to respond to the virus. Period. The end. And the vaccine itself is gone within 48 hours. It has taught everyone. It calls everybody up into the lymphatic classroom, teaches the lesson that needs to be taught, and then it is gone.
Really?
Period.
Hmm.
And then those T and B cells have memory.
So they know what
And
to
they
fight
know
when they see it again.
Exactly. The old vaccines, and I always used to liken it to, if it's a dead vaccine, the vaccine goes through 4 dishes of wash cycles in the dishwasher, basically. So they come out dead, but recognizable. So it's like a perp walk kind of thing. Okay. You're dragging around this guy so that the T and B cells can recognize it. It's a wanted poster when it's a dead vaccine.
Mm-hmm.
It's a perp walk when it's a live vaccine, like the what's a live vaccine? Varicella or measles, mumps, rubella, those kinds of things. Those are live vaccines. So you're getting injected with a guy who's severely beaten and handcuffed. Can't hurt you,
right?
But he's recognizable. So when those T and B cells see it again, they go, I know you. Right. You got to go.
I was lucky. Everyone in my house had COVID. Mm-hmm. And I did not get it. And I am right. God is good. I'll tell you that much. I did have my children had the vaccines. Mm-hmm. They didn't get them all. I think they got the first 2. Mm-hmm. I had all of them, and I did not. And I was the one taking care of everybody, but I was masked up, gloved up, all of that. Anytime I would go into the room and slide stuff under the. No, you won't get me. I'm sorry. I'm not coming with it. No. Everybody had their own room. They couldn't come out the room. It was a mess. But I did not get sick. Thank God. Good. And I did everything that I could, washing my hands, waxing and bleaching and everything that I could do, Lysol and everything down, so that I wouldn't get sick. It was a lot, but yeah, I remember when I used to get my groceries delivered all the time because it was COVID and I literally had just had surgery and everything. It was 2020, and so I was getting and I would make my daughter go outside and spray the bag with because we didn't know at that point. We had no idea. You had to Lysol everything, and even before it came into the house, wash your fruit and all this different kinds, because you just didn't know. Exactly. It was such a scary time, and I'm so afraid that it's coming back. I am really, really afraid of it because I was just getting out of the hospital. I was like, oh, I'm finally free, And then I was on lockdown all over again. I was like,
no, get that vaccine, girl, because you probably the last booster you had, the bivalent, is probably worn off now.
Yeah, I'm sure.
So get this new one that's coming out. It is effective, not as well because against the Omicrons that are out now, but it is more effective against this XBB. That's 1.5. That is going to be the dominant variant this coming winter season. So you definitely want to make sure that you get this monovalent. I have not had. I'm a tiny bit sore where they gave the shot, but that that's normal. Yeah, you feel a little bit of warmth there. That's normal. That's your T and B cells coming to the vaccine site to pick up the recipe. And then to go along, run around your body, take a good surveillance look, which is what every time you get a vaccine, you generally will feel a little bit logy, a little bit tired, a little bit achy, a little bit feverish, but that's your immune system being called to order. It likes to sleep in your spleen, nice and quiet, squirting out the odd surveillance guy now and then. Your immune system is very lazy. Okay. When you get a vaccine, everybody has to come running. And when that happens, it makes you feel
Tight.
like you're in a dryer with 17 pairs of sneakers and somebody flicked the dryer on. And that's normal. So to feel kind of achy and crappy after a vaccine is normal.
Right.
So that's not a side effect. That's not a horrendous, oh my God, I got really sick.
It was bad. Like I was arguing with people about this vaccine.
Yep.
Friends, family. And
yeah. It split families up.
Yeah.
It split up neighborhoods. It split this country down the middle.
It did.
It was right in the middle of all of the conflict.
Right.
You know,
when it was
George Floyd conflict. You know, the whole thing, the Republican Democratic conflicts, you know,
it was a mess.
It was a hot mess. It was extremely poorly handled. The way it all went, because the experts were dismissed and the rumors were allowed to perpetuate. Right. And that was just a bloody shame. Hot mess.
It was a bad time. It was a real bad time. I ask everyone this question when they come into the room, into the podcast: who is or was your role model?
I've had many role models in my career.
Yeah.
And some were more educated than me, and some were patients, such as yourself. But honestly, people that you come across who have looked into the abyss and the abyss looked back, and they can stand proud and create what you've created. That's a role model to me. I have Tammy Austin Ketch, who's the dean at SUNY Upstate Medical. She was in charge of the family nurse practitioner program at UB. And she pushed me to write. She pushed me. I found out at the end of the last semester, let me tell you this little piece of information, Tammy Austin Ketch, that I was writing 20-page papers and people were writing 1 to 2 page answers on assignments. And I didn't find out until the very end of the program that these people were only doing 1 or 2 pages.
Wow.
And I would write a 20-page dissertation on, a case review. And I swear, I think she just threw my thing down the stairs and wherever it landed, that was a grade I got. And thank God it was heavy enough to make it to the bottom.
Right.
But she could always count on me doing a thorough job, because adult students are crazy like that. But there was another nurse that I worked with who was a hospital aide at ECMC. And, I knew she was smart. And I told her, I said, you gotta go back to school. You can't do this the rest of your life. Don't do this the rest of your life.
All right.
And she went back to school and she got her master's.
Wow.
And she finished. And now she's retired.
Wow.
And wicked smart. But you can spot wicked smart.
Yeah.
And you're wicked smart.
Who?
You.
I am not smart.
Girl, listen.
You
are taking this one step at a time, the way it needs to be done.
Yeah.
You understand you have a gift. Yes?
I'm trying to get there.
Yeah, exactly. And that's all it takes is trying.
Yeah.
Don't get in your own way. Never be your first no.
Yeah.
And don't listen to the next one you hear neither. It's just.
Yeah.
My mentors have taught me that.
Yeah.
They may not have said those things, but they taught me that.
Absolutely. We all need to have strong mentors, because life is not easy,
Mm-hmm.
and all the time you are usually your first no.
Mm-hmm.
Like I think about things like, oh, I should do this, and I'm like, nah, I can't really do that. Who am I? Right? Exactly. We do that all the time.
Do not say that around me.
Yeah. It's something that we do because we think we're not smart enough, we're not capable enough, we don't have the right money, we don't know the right people, those kind of things. And then,
well, the answers are: who do I need to go meet? Where do I need to go hang out?
yeah.
How do I meet those people? How do I find the sources that are going to help me move forward? And it's not a matter of, I think what stands in your way, Fatima, I don't want to feel like I'm using people.
Yeah.
Because you are kind.
Yeah.
And that's not what that is in business. That is called networking. Networking is not using people.
Mm-hmm.
It isn't.
It's not.
Because they're out to do the same.
Right. Everybody's out for.
They want exposure as well. Yeah. And to look at the exposure that they would get by helping someone such as yourself with the goals that you have looks good on them as well.
That's true.
So instead of seeing your cup half empty, girl,
it's filling up.
Yours is half full and it's got flowers in it.
That's beautiful. It's definitely filling up. I do want to ask, where, I know this is crazy, but AI is a big thing right now.
Yes.
Where do you think, or where do you see, or what changes do you see with physicians, doctors, nurse practitioners, medical field altogether with AI?
Mm-hmm. AI is already here.
Yeah.
It is already here. We have, dictation systems. We have note, I have this migraine medicine that I take, and it gives me word finding difficulties sometimes. So I can't think of the word I'm trying to think of. Where templates, where you can just hit a button and your template comes up for a diabetic, and you fill in all the blanks for the questions that you ask your patient, that kind of thing. So it makes your documentation
easier.
Yes, that is long and arduous otherwise. And you're no doubt going to forget to write something. There's certainly things that are extremely frustrating that you miss or you forget to do. And they come along and they say, well, you didn't click this button, and you didn't click that thing for billing, and you didn't put down this diagnosis, and you don't have enough documentation to support this blah, blah, blah. And you're like, you know what? At the end of the day, the patient got taken care of. Can you just leave me alone?
I feel you. Yeah.
Because the Canadian in me is struggling with this system here, because I just want to take care of people.
Is it really different in Canada?
Oh, heavens, yes.
Really?
Everybody thinks, everybody waits so long. That's not the issue, really. People get what they need when they need it. The difference here is everybody wants what they want, when they want it, how they want it. That's the difference. That's capitalist medicine in America. In Canada, you get what you need when you need it. Okay? If you have a bad gallbladder, but it's not infected, and it's causing you a little bit of acid reflux and a little bit of pain, you're going to wait a few months to get it out. It's not killing you.
Right.
Okay? And of course, everybody's going to be able to come up with the yeah, but story. Of course, that yeah, but story, don't kid yourself, absolutely happens here. Hundreds of thousands of times a day in a country where there's hundreds of thousands, if not, well, of course, 20 million people who are uninsured, not getting any care whatsoever. Absolutely. So don't tell me that you're afraid of having to wait when you've got 20 million people in this country alone who are uninsured, not getting any care whatsoever. Yeah. They're dying. You have people dying in this country because they can't get care. So don't tell me you're worried about a little bit of a wait
time. Yeah, that's when you think about it that way. Because I've always heard that it's cheaper in Canada, but the wait time is a lot more expensive.
Of course.
Just like Mexico.
Because you can't tell somebody you have to wait for your Big Mac.
Right.
You know what I'm saying?
Right, exactly.
This place, you know that the time you go from the speaker to the window to your food should be less than 2 minutes. Do you know that's a McDonald's rule?
No, I didn't.
Yes, 2 minutes.
2 minutes. Wow.
2 minutes is their industry standard.
Wow.
And people expect the same thing from medicine.
Mm-hmm. And you can't.
You can't.
You can't.
You cannot. And when people have that kind of expectation on a humanities-based service,
yeah,
please.
That's why I call it. We live in the microwave age.
Mm-hmm.
The microwave. We think everything 1 minute, 30 seconds. You know, everything. This is the microwave age.
Oh, girl, yes.
And especially our children aren't better because they got the computer right in their hands. They can look it up just like that.
Mm-hmm.
They don't got to go to a library
Mm-hmm.
to take notes and things of that.
Mm-hmm. Oh yeah, can you remember writing notes with a pen?
Yes, right. We just speak it into our phone.
And that's what I used to say about medical records. Every time the computer goes down, I said, if my pen ran out of ink, I just went and got a new pen.
Right.
My computer goes down, everything shuts down.
Absolutely, it's a problem.
Mm-hmm.
What do you feel about supplements and vitamins and things of that nature? Because nowadays, I see a lot of people advertising the supplements and vitamins, and I think they're kind of tricking us a little bit.
Oh, they certainly are. Yep, vitamins and supplements and alternative therapies is this is another soapbox of mine. It is a over $25 billion out-of-pocket industry currently. They are generally unregulated. You want to look for vitamins that have the USP stamp on them. United States Pharmaceutical has evaluated the supplement, vitamin, whatever, and it, by that USP stamp, it has in it what it says it has in it. Okay. So let's take for example, there's two companies like Nature's Made and Nature's Bounty. Those two are USP stamped. Okay. Prices are not controlled on these vitamins well.
And I think
it's not an industry standard. Some of them are crazy expensive. Yeah. And you don't know, honestly. You could be getting sawdust and a flake of what it says is in there.
Yeah.
So, and people don't understand what chemical names are.
Right. Because they're long. They got every letter in the alphabet.
Yes. And the names as they are listed in the order of
what the
prevalence,
how much it has.
Yes.
Yeah.
So if, sugar or dextrose or sucrose or cellulose are your first items of the day, that's your dominant ingredient in your supplement.
I have a problem with sugar altogether. You already know
how
I feel about
girl, yes.
It's the number one drug in America.
Yeah, and they hide caffeine in a ton of different ways when you're looking at supplements that are diet and appetite suppressants. You can look at guarana and all these other supplements. All these muscle building agents have all of these caffeine products in there to get you feeling all jacked up and powerful. But you need to be extremely careful because a lot of whey protein they're throwing in everything, and whey protein does not have as much protein as
really?
People say it does. It's a fallacy. So you just, the last place you want to find yourself is inside a vitamin store. I will tell you that right now. And the cheapest place that I found two vitamins that I'm on, which is vitamin D and vitamin B12, $22 for 1 year's worth of each of my vitamins on Amazon is how I found them the cheapest.
That's a good deal.
My numbers went from a vitamin D level of 7 to up to 58.
Really? So
And-
vitamin D, it gives you energy, right?
Well, vitamin D is responsible for kidney health, bone health, helps with mood, muscle, memory, motivation.
You're gonna have
Okay.
to send me that because $22, that's a good price.
Yeah.
Because I think I go,
And that's for a year's worth of
yeah, because I think
medicine.
I go to Walgreens
Mhm.
and one is $22, literally.
Yeah, for 30 days.
Yes,
probably.
30 days.
Yeah. Now 1 year, 400 gel caps,
Oh, okay.
and it's about $22.
That's
You
a
know,
great
I think the
price.
most expensive I've seen my B12 was 28, and that was for 400 gel caps as well. So
what about, like, I know a lot of our sports kids, I have a sport kid, dance, cheer.
Yep.
My son, football.
Been a dance mom for many
forever,
moons.
right?
Yes.
What do you think about the Gatorades and the Powerades?
Too much sugar.
Yeah.
Drink water, throw some flavor in there, throw some fruit in there, lemon, orange. You know, if you want flavor, that's fine. You know, unless you're out on a football field on a 90-degree day, I see no utility in Gatorade. You know, most of these kids are not expending enough energy and sweat, honestly. Like the kids that are dancing and maybe dancing at the competitive level, or alternatively, really not fit and are sweating a lot. Those kids, I might go with a very small Gatorade and then augment with water to get the electrolytes. Yeah. You know, but the amount of sugar in there is really incredible.
Really?
So,
I'm surprised by that. Well, I'm not surprised because I've heard that a lot lately.
Yeah.
But when I started first giving my daughter Gator, she doesn't drink them anymore. She doesn't like them. She would rather have water now. So I'm a water drinker. Yeah. I drink nothing but water. I actually had this apple cider vinegar today, or apple cider drink by Mayors, but it was sugared up, and I can feel it. Yeah, because I don't really drink a lot of sugar. I drink water all the time, but it was good. But now my stomach is hurting. Yeah, because number one, I drank it too fast. Number two, it's a lot of sugar in it. So
it's funny when you don't do it for a long time, and then all of a sudden you do a sugar rush thing and you're like, But
listen, the sugar, I am so addicted to sugar that if I go a day without it, I feel so sick the next day. It is definitely a drug. And America knows this. Oh yeah. All the pharmaceuticals know it. Oh yeah. All the food companies know it. Something has to be done about this. Because when you die and you're obese and your BMI is over 20, they don't want to give
over
you
40.
Okay. They don't want to give you the medicines you need to take care of that or help you with that. Right. Or they look down on you for that.
This is the biggest struggle I have in practice. I have someone like who's pre-diabetic, whose BMI is high, and they won't let me treat them for obesity and pre-diabetes, which is when you really should be striking when the iron's hot.
Yes, absolutely.
I want to treat smoke, not flames. Let me put the fire out before the whole house is burning. No.
They want you to be dying.
No. Thank you very much. No.
So that goes into the next questions. How do you feel about the pharmaceutical companies? And do they make it hard for the doctors? I know they make it hard for some of these patients.
This country, you know, it just kills me that I can go, when I first started, when I was a diabetic and I was starting on the weekly medications, I was started on Trulicity. And for someone to purchase the dose of Trulicity that I was on would have cost them, I believe, $580 at the time.
Oh, wow.
A month. That's a lot. Well, that is a lot. I've seen them charge more for Ozempic, $1,400. Okay. And in Mexico, for that same drug, it is not a different drug. It's made in the same foreign country from which we purchase Trulicity. Same. I would pay $32.
That's crazy. That's absolutely nuts.
And people will say, "Oh, it's not the same. It says you're buying it in Mexico." you've just been taught. You have just been taught and poisoned to believe that you must get your medications in this country.
Yeah. So I've been seeing,
and that you have to pay more money to get that value.
That's the pharmaceuticals.
That's what they've taught you.
Billionaires.
Well, yeah, exactly. Capitalist America has taught you must buy your things here. They must be American. But meanwhile, these drugs are coming to these pharmaceutical companies, and you open up the package and it says made in India.
Right. I recently saw Ozempic. A girl that somehow became my friend on Facebook was selling Ozempic. And I'm like, are you kidding me? Like, how are you selling this stuff?
Yeah.
And like, obviously she had a lot of it because she was selling it to people. Like, how do you do it? Like, where do you, from what I understand, it's very hard to get Ozempic. So how is this one person getting it and selling it to other people?
Who knows?
Somebody
in some pharmacy is backdoor selling it.
That's crazy. And that's how the opioid crisis started.
Sure.
People like those.
Well, this is how desperate people are to lose weight. This is how desperate the obesity crisis in this country is. It's just as desperate as some other people's addiction to drugs.
It is.
It's not a bad thing to want to lose weight, but look at the lengths to which people are willing to go. The over-the-counter alternative therapies relative to weight loss, look at the billions that are spent on that.
That is very true. But so my whole thing is they give us these healthy foods, so they say, granola bars and stuff like that are supposed to be healthier than regular granola bars and stuff like that. But it's so hard to even read the labels, or it's so hard to understand it.
What do you think their intent is with that, though?
They don't want us to.
They don't want you to read it. They don't want you to understand it. They don't want you to figure out that they're lying to you.
That's crazy.
So the harder it is to read, lesson, don't buy it.
Yeah. It's crazy. It's really crazy because America is America. And we live here.
We are a country dependent on the ignorant.
Wow.
Sadly. Because, the smarter you get about things and the more you read, the more you learn, the more you become disillusioned.
What do you think about CMOS? Do you know anything about CMOS? Is it a good thing or a bad thing? A lot of people nowadays are doing the CMOS thing. And the AC and apple cider vinegar.
Apple cider vinegar has been actually a weight loss acid reflux reducer. Trying to think of all the other uses that apple cider vinegar has. But apple cider vinegar has been like the aspirin of grandmas for decades. So apple cider vinegar is not new. So it's just cherry juice, sour cherry juice for arthritis. That is not new.
Oh, I've heard that. So
oh yeah.
But have you heard of CMOS?
CMOS, no.
So you don't know.
I've heard of it. Have I seen its effects? No, I have not. I have never had anybody come to me and say, I use CMOS and I've lost weight. I've done this. I've done that.
I think it's for more or less for the immune system, though.
There's no measurement for that, though, Fatima. There's no way anyone can say, I take CMOS for my immune system and been able to show anyone they have any improvement in their immune system whatsoever.
I know. I have a cousin. And she's always, you need some CMOS to make sure. I'm like, girl, I'm not taking that stuff. I don't know where that comes from. And who's making it and none of that. I just don't know. It's unregulated.
Right.
You got your own thing. Do you like it or do you not like it?
I like it. It's good. It has, it's just minerally. I mean, measurable. How does it make you feel for real? when you try it, when you taste it?
I've never
eat
tried
it.
it.
Right. So I've done it with smoothies. I've done put it in smoothies. I had it
Yeah.
direct.
How much do they charge you for it?
I buy mine by the pack. It's not expensive. It's not $25 for the whole thing for a package of it.
And how long does that last you?
It can last about a month or 2 months. You just got to take it, wet it, blend it, and you make it your own. But now, if I take it and repackage it for you, I can charge you $3 per little packet because I'm doing the work. And now, it's because you pay for convenience. So it is a matter of just, but you got to know your health, you got to know your body, you got to know what you need, and everything doesn't work.
How do you know what you need?
Huh? How do you know what you need? You go to the doctor, you get your report. I'm not going to go into the doctors, I'm not going to those things. But just like Big Pharma has this agenda and this goal, objective, there are some things that people just believe that the earth produces that help. Just like, hey, apple cider vinegar, just like, and just like weed as well. Because
Well, I'm not saying don't use it. I'm just saying won't hurt you, might help you, but it's not a measurable response.
Understood. And it's just the only measurement that I could probably give you is you have to know your body.
If you're feeling better.
How you feeling.
How you
also go. You don't have to necessarily have to always report, oh, doctor, this is what I'm doing. Let's see what they say when you go to your next visit. What are they saying about when you go to your doctor? Oh, your numbers, your AC1 levels are looking a lot better. Oh, they can assume that it's your medication, but let's pay attention to what's happening.
But now, here's the thing. Here's your secret thing that he just said. 80% of your patients will use some alternative therapies. Only 20% will tell you that they do. It's really, really important for us to know so that we can say, listen, if you're using something and it's working,
then we know.
I want to know so that I can say, listen, there's this CMOS stuff out there and that we can lessen some of your medicine if you use this. I mean,
I get you.
And I know for a fact that she is definitely one of those type of doctors that's going to go above and beyond and do the research and, even call another doctor like, hey, what are you doing? And she is definitely one of those. She's a good one.
And I get
You're probably not going to find them.
Right. And our second challenge is that this is just me being the antagonist of the situation is that my methods don't pay you. It all depends on where your heart is in the investment. My method doesn't give you the pharmacies their funds.
Right.
I don't call from my insurance for the refill to pay them to do. You know what I'm saying?
Absolutely.
And those who don't have a heart for it, they can then be like, "No, get back on what I said."
Yeah.
They're trying to. Everybody's not like that. I'm not saying everybody's like that.
Definitely. I think a lot of you just never know.
Yeah, for sure.
Because some doctors, they're not. And I don't know if it's the heart or the science. Sometimes,
it could be
both. Right? It could be both.
It could be both.
It could definitely
because you can't argue if something's working, and the problem with medicine is the data-driven responses,
right?
And everybody wants the randomized, controlled, double-blinded trial, Yet, unfortunately, no one wants to invest money in something they can't make money from. Absolutely. You're not going to have somebody invest money in a test to see if parsley helps diabetes.
Right.
Meanwhile, it probably does, and it could work great, but nobody wants to put the money into it. But grandmas for thousands of years have been using cinnamon, true story,
absolutely,
to treat diabetes. And it works.
Absolutely, it does.
It has been proven. So you know what I mean? Like there's so many alternatives that work, but there's so many that do not. And it's harmful. Just scary.
It is very scary. Well, it's coming to the end of our show. Thank you so much.
Are you serious? It went so fast.
It's so fast, right? That's what I tell you. Everyone's like, I'm scared. I'm like, don't be scared because it's just conversation. You never know. You never know. But it went great. You did wonderful. Thank you so much. I am honored to have you here. I really am. When we talked about it, I was like, oh my God, I was just telling my best friend this morning, like, I'm so nervous because I have to be professional. But it wasn't. It was a real good conversation. And I hope the Fatima fam out there, I hope you learned something from it.
I hope so too.
Yeah. Thank you so much for being here.
I love you.
I love you too, sweetie. All right. Don't get that board wet.
I thought that juice